Hello. So I thought I'd try making a follow-up video about my wisdom tooth extraction journey. I have had the extraction, it went ahead, and I did get a coronectomy, and I'm talking maybe a bit funny right now because I'm still in kind of slow mode. So I'm 72 hours post the extraction now. I've seen other videos where people are talking absolutely fine. I probably can talk fine, but I'm in this kind of like slow mode where I don't want to get dry socket or anything like that. I don't want to disturb the site. I'm probably don't need to be this cautious, but I just am. And I've also got some numbness still after 72 hours. Well, it's actually more like a burning sensation. So this part of my mouth actually feels quite tight, burning kind of sensation, I guess. So I'm still a little cautious, but I'm going to try and make this video. So yeah, the extraction went ahead. In my other video, I mentioned that I wasn't sure whether I was going to have a full extraction or a coronectomy, and I was a bit nervous about that, and I really wanted a coronectomy. Thankfully, I did have a coronectomy, because I was ready to kind of argue my case and maybe even turn the surgery down. I did have a coronectomy, and I think the reason was, it turns out that my root, the nerve actually goes through my root. I originally thought that that was some kind of like technical error. That red dot going through the root there, I thought was like just a rough guide, and actually the root was the nerve actually goes around it, and it was that black canal. But apparently not. Apparently that red line is literally the nerve. So that's how, if you look at it, it goes right through the side of the root there. It's not even right through the middle. It's kind of just awkwardly on the edge there. So I mean, the bit of root on the other side is just, that's not coming out, is it? So anyway, it goes through the root. And the oral surgeon said, he would have had to section the root to get it out if he to do that. But I imagine that's part of why he switched to going for a coronectomy. So he decided to go for a coronectomy, and yeah, but he was still cautious of that because my tooth is decayed, and he was cautious of that. He also mentioned I had decay around the bone and all this kind of stuff, so it's quite a lot of decay, but I guess he considered it worth the risk to try a coronectomy first at least. So hopefully, at the moment, everything's gone well. I've had very little pain other than this numbness. I've got a burning sensation, obviously because the nerve went through the root, and so I'd imagine it's had a lot of vibration with the drilling, a lot of bruising and stretching of the nerve, so I think it's probably normal. Hopefully, I think it is slowly coming back, but that might be me just imagining it. But anyway, yeah, so Friday it went well. I had the surgery, I had the coronectomy, thank God, because I really wanted to just get it over and done with. I've got 8 days off work, I booked off. I just really wanted to kind of just start recovering, get it over and done with. I didn't want to have to wait another 2 months and delay it. And so far I've had actually very little pain, although I've been on the painkillers, but I guess they worked. He said that I could have a lot of pain, but I haven't really. Painkillers have numbed it most. It's just this bit. This is the only pain. This it's not really numb. It's more burning, kind of. So that's the only problem. I'll talk more about that in a mo. I'm not sure if anybody will watch these videos. I'm making these more for myself, I think. So I'll just go through it all. I'll start with there were some lessons I learned going into this. The big one is take care of your wisdom teeth. Anybody out there, anybody watching this video are probably already aware of that. They've probably already got problems with their wisdom teeth. But, let your friends and family know, because I just didn't even think about my wisdom tooth for a long time. I was having, a chunk cracked off of it. I left it for ages and ages because I just didn't think it was a big deal. I didn't realise it was actually like a really, really important tooth. So, yeah, take special care with your wisdom teeth because they're the hardest to extract, I guess. Another lesson I learned was to do what's right for you, because I was in this dilemma of, do I go for a full extraction or a coronectomy? And if my oral surgeon offers me a full extraction, do I just go for it and get it done with, or do I delay and see if I can find another oral surgeon that would be willing to do a coronectomy? And part of my thinking was, it was a kind of a self-esteem thing, because part of me was thinking, I don't want to I don't want to keep hassling other people. I don't want to have to take another week off work. I don't want to do all this kind of stuff. And there was a part of me that was like, well, maybe I should just get a full extraction so it's over and done with, so that I don't have to keep disturbing people and I can just get back to work, because other people don't care whether I've got nerve damage or not. As long as I can work and be a functioning employee, they don't care. And I was kind of thinking like that, like, should I just get a full extraction and get it done with? Because I don't like disturbing people. And then I thought, that's like a low self-esteem thing. I've got to do what's right for me. I've got to do. I have to get. If I think there's a chance of getting a coronectomy somewhere else, I need to pursue it. So I had made the decision that if he can't offer me a coronectomy, I'm going to have to delay the surgery and keep looking elsewhere, just for the chance. And the third lesson as well was like to try to think logically, because my logic there was worst case scenario, I just get a full extraction in a couple of months anyway. It's not that big a deal. But there's a chance I might be able to get a coronectomy. So that is try to think it all through rationally, logically. Anyway, and then I had another thought as well, which is that this is just for in case people are in my situation where you're not sure whether you're going to have a coronectomy or a full extraction, which is probably rare. But I did think that in the week leading up to it, one thing I could have done is just put loads of emails out to loads of oral surgeons, as many as I could find, and just show them my scans and ask them, would you be willing to do a coronectomy? Because if I had that information going into this surgery, knowing that I've got like a whole handful of surgeons that I could turn to if this guy doesn't offer me one, then that would have been handy to have known that information. But I didn't think about that until like the day when I was sitting in the surgery and thinking, you know what, I should have done that. I should have just emailed loads of oral surgeons and just asked, would you be willing? Because I was kind of going in blind. I was going to have to deny the full extraction with no knowledge of whether I could get a coronectomy elsewhere, just hoping. And so anyway, that was just a little thing. And the last lesson is have a big breakfast before your surgery. I had a big old fry up, loads of food, because I was very reluctant to kind of eat anything or move my mouth or do anything afterwards. And you're on a liquid diet for a while, so have a big breakfast before you go in. That's just some lessons. And then the surgery, the actual operation, so it went well. So the surgeon agreed to do a coronectomy, thank God. I didn't have to talk him into it. He was, happy to do it. So that was such a relief, because I was so nervous about it going in, like, because I really didn't want to have to wait another 2 months. I bought loads of soft foods. I booked a week off work. I would arrange for other people to cover. I just didn't want to have to go through all of that again in 2 months. And with the decay getting further and further, I just wanted to get it over with. I prepared myself mentally for the whole thing as well. So glad. Once he was willing to do the coronectomy, I had almost felt like that was my job done. My job, I felt, was to make sure I've done all I can to make sure I get the best care for me, that is the right choice for me. After that, I'm like, it's just, I left it into the hands of the oral surgeon and God and fate and stuff, and just thought, well, I've done my job now, and what will be now. So, so he agreed for a coronectomy. I was happy after that. He mentioned the nerve going right through the root, which is amazing. So he would have had to section that root to get it out, which would have been tricky. I did ask about, because in a coronectomy, supposedly after you've done it, the roots migrate away from the nerve, so that if they ever need to be taken out at a later date, they should be migrated away from the nerve. And I asked him if that was still the case in my case, even though the nerve goes through the root. And he seemed to think so. He seemed to think yes. Now, I don't know if he misheard me or if I misheard him or something, but I'm pretty sure he said yes to that. I'd like to get it confirmed, but that seems to be the case. Actually, no, I think I Googled it as well, and Google seems to say the same thing. I think so. But then Google was like, everything's AI nowadays. I don't know how much you can trust it, but it seems to be that that's the case. So that's good. Yeah, and he also mentioned I've got some decay around the tooth here, which is another new piece of information I didn't know, whether he said the decay had kind of spread. He also said it was kind of normal, or something like that. A lot of people have a bit of a gap here anyway. And he would often talk like that. The oral surgeon, he would give you a kind of a warning of bad news, good news, bad news, good news. He would say something bad and then say it's normal, it's fine, don't worry about it. Yeah, but basically this is why a coronectomy maybe was risky for me, because I've got quite a lot of decay spread around the bone as well. And during the surgery, he did mention he said something about the top root not being absolutely perfect. I didn't catch what he said. It didn't seem to be too much of a problem. It was like a little thing, but I think I've just got to go well careful with infection and just hope that I don't get infected. So fingers crossed. I asked him about the risk of infection, and he said it was like 5 to 10%. I was expecting him to say it was much higher than that, especially in my case, but he still said 5 to 10%. So that's great. In fact, that was so low. I was thinking, well, what's the problem with having a coronectomy then? Why are you risking 25% chance of permanent nerve damage for a 5-10% chance of infection? Like, surely that's better. 5-10% chance of infection. Just get a coronectomy. Anyway, but that was fine. And then during the surgery, painless. Like, it was surprisingly painless. Like, I was expecting that, to be like considerably more pain than your normal dental operation. It went on longer. It went about half an hour, but it was just numb. I didn't even have to stretch my jaw wider than I thought I would. It's just a normal dental operation, really, and I could just feel him drilling and doing all his bits and bobs. I was well up for it, because once I'd had that good news that I had the coronectomy, I was just fully on board. I was on team oral surgeon. Let's just team sit as still as I can, be the best patient I can be, don't make any sudden movements, turn my head wherever he wants me, all this kind of stuff, like just do it. So so the surgery went well. He said it went well. There was a fair amount of blood. I could taste it, and I think he said afterwards he was quite close to some nerves. Like, there's a lingual nerve as well. The lingual nerve, actually, he said, doesn't show up on these scans. It's on the inside. And I think he was quite close to that. I don't have any lingual nerve damage, I'm pretty sure, because from what I've read, you would have lingual nerve damage if you can't feel the inside of your tongue, the bottom of your mouth, the inside of your gum, things like that. All of that I can feel. I can taste, I can feel. I don't think I've got any lingual nerve damage, nothing. So that's good. And I've read, I looked at other oral surgeons, and the thing about blood, they say that, I think that's normal. I heard one oral surgeon saying, you can get quite a lot of blood, because as you get close to the nerves, the nerves are surrounded by arteries and blood, and so you're getting close when there is blood. So I might have been close, but yeah, I think it was normal, so that's fine. He mentioned it, and then the only other thing he kept doing was every now and then he'd give these warnings, and then follow it up with a kind of everything's okay, a kind of a positive thing, like good news, bad news. And during the surgery, he just suddenly started going over all the potential nerve damage I could have. He'd already told me, and I already knew, but he started going over it again about the burning sensation and things that you could have like that. And I was like, why is he telling me this right now, right in the middle? And then he said, but thankfully you're going to avoid all of that because you're having a coronectomy. I was like, oh, so that was his point. His point was he was trying to say all of this kind of nerve damage you could get, I'm going to avoid because I'm having a coronectomy. So I was like, okay, but you're saying, sometimes you don't get permanent numbness. Sometimes you get a burning sensation, and it's actually hurts to touch, which is kind of what I've got. So maybe, I don't know, maybe he was trying to hint, I don't know. And he said you can take like antidepressants or something, which my dad had nerve damage after a I can't remember what he had, something with his heart and his artery. I can't remember what you call it now. Geez, it expanded, a big bubble, and it burst. And he had to have a stent or something like that. He had nerve damage, and I remember some of the medication he was having was, I think it was to do with like antidepressant types of medication. There was some weird medication he was having that seemed to work for nerves. At the moment, I wouldn't take antidepressants. I don't like taking meds if I can help it. So I would probably just live with this if it stayed like this forever. At the moment, I'm not thinking it will. I'm fully expecting it to get better over time. I already feel like my chin is a little bit better than it was. So, and I felt some, like, the fact that I feel pain, some sort of sensation. I've had my brother touch a pen to my chin like that while I've got my eyes shut, and I can feel it. And sometimes I get the little ants crawling over your skin feeling. So all of that is a sign to me that it's healing, is my opinion. Hope, at least, anyway. So yeah, I wouldn't take meds. I think it's going to be okay, and it's healing. But yeah, he would do stuff like that. Anyway, that was the surgery. It was fine. Half an hour, not much pain, pretty easy. Way easier than I thought, to be honest. It was like just a normal surgery, really, like root canal or anything. Didn't feel anything. He put three anaesthetic injections, which is, I heard, is a lot. I think you usually get 2 and then a third if you need it, I read somewhere. He went for all 3, presumably because of the fact that my nerve was so intimately linked to that root. And I hoped that was why it was taking a long time for this to wear off. But now we're 72 hours out and I can still feel it. So there's definitely, the nerve has definitely been bruised or stretched. But then, yeah, so then the recovery though, when I came out, and since I've come out, the first thing I've done is I've been in like slow mode. And I'm still in slow mode now. I've just been trying not to do anything because the number one thing is, should be infection, but it's dry socket is the thing I'm concerned about. It's that blood clot. You don't want to dislodge the blood clot. So on day 1, I didn't even talk much on day 1. I don't want to talk much. I didn't eat anything until like 4 or 5 hours out. It was just liquid diet. Didn't want to move, didn't want to touch anything with it. No exercise, no rushes of blood to the head. Don't bend over. Don't do everything. Just do everything slowly. That was my thinking. And I've kind of still been in that mode. I've done no exercise. So I'm quite tired because I usually exercise a lot. That's what wakes me up. And I've just gone into proper slow mode recently. So that was the number one thing. Just don't disrupt that blood clot. So do everything slowly. Then there's lots of technical things like ice packs. I started icing it on and off, 20 minutes on, 20 minutes off, pretty much from day 1. I stopped after about 48 hours. I heard you're supposed to kind of switch to heat or just stop after 48 hours. It doesn't make any difference, but I was icing on and off, 20 minutes on, 20 minutes off, straight away. Painkillers. He had me on 2 paracetamol, 500 grams each, so 1,000 grams or milligrams of paracetamol, and 2 Nurofen, 200 milligrams each. I have all of that in one go and do that every 6 hours. I've been doing that maybe every 8 hours, probably more like every 8 hours. That seems to be enough for me. As I say, like, haven't really felt much pain. I've been quite surprised. Was anticipating a lot of pain, and I was just anticipating myself having to just sit here and just really grin and bear it. But thankfully, no pain at all. Really, very little. Well, I mean, it's a little bit there. Maybe the painkillers are working, but so haven't had much pain. Antibiotics, I've been doing well with that, taking that when I need to. Antibiotics for me, I have trouble swallowing tablets. The only way I can get them down is with mashed potato. So I had to have mashed potato on day 1, which is a bit tricky to eat, and it did kind of stung a little bit, and I didn't really want. I had to kind of squeeze it in my mouth. Didn't want to open my jaw too wide, but I got it in. I've managed to swallow every antibiotic tablet so far. So that's good. But I have to do it with mashed potato. It's the only way I can get them down. I'm not very good with swallowing tablets. But that's been fine so far. 3 a day. The saltwater washes, don't do any of that on day one. Just don't even brush your teeth. Don't do any, just like day one, just do nothing. And then day 2, I've started saltwater washing, but I get warm salt water and I just kind of swill it like that. I don't do anything vigorous. Just swill it around, leave it in there for like 2 minutes. Like I just leave it in my mouth for 2 minutes and then spit it out. And I don't even spit. I just kind of let it drip out, let it drool out. Nothing, you know, no sudden movements. Yeah, liquid diet. I've been on a liquid diet day 1. I started craving and wanting to go back to normal solid foods a little bit, just like soft foods. And I think I could do them. But I've kind of actually, this morning, I've gone back to liquids because there's a new problem I've noticed, which is I've been chewing my cheek. And I guess this is part of why, that was something I hadn't even read about, chewing my cheek. Of course, my cheek has swelled, not that much, but it has swelled on the inside a little bit. And I particularly think these teeth here, that one up the top there, is like, it sticks out a bit. It's got quite a sharp edge, and so just a little bit of my gum inflamed a bit there. I do kind of scrape it a bit sometimes. So I don't want to do that yet. So I think I want to let the inflammation and the swelling go down a bit before I have too many soft foods, or if I am going to have soft foods, just chew very carefully. Thankfully, I've got this right side I can chew on, so that's good. And I hope that when the swelling goes down, that should be okay, and I can just eat again normally. But I hope that's not like a permanent problem I'm going to have where I can't actually, because I don't think I can close that side of my mouth at the moment. Like I can't get the teeth to connect. And I'm also wondering, like, they say these teeth need a bottom one so they can kind of like have something to hit. And I wonder whether that tooth was hitting this one, and now that that's gone, I'm not sure what will happen with this tooth. But then I suppose we've got one over here that's got nothing to hit, so I won't worry about that. I think my teeth will hopefully be all right once the inflammation goes away. It should be fine. Yeah. But I've had like very little swelling. I don't know if you can really see. I got a little bit there. I mean, you don't know what my face normally looks like, but it's, you know, I think one side of my face, it's this side here. It's a little bit of swelling. It was a little bit more on day 2-ish, but I think it's gone down a bit now. So I've been lucky with that, and no bruise either so far, so which is very weird. I was fully expecting to get a bruise. I had a massive one when I had a blood test the other day. Had a massive one on my shin when I cracked my shin the other day. No bruise, not much pain, not much swelling. Amazing, really. So touch wood, but I'm not out of the woods yet. There's still infection and dry socket and other complications that can occur. So yeah, but so far so good. So far so good. And then what's that I've written there? Don't talk too much. I've already said that. I'm talking weird now because I'm just trying not to move my mouth. Switching to heat. Yeah, after 48 hours, I think you're supposed to switch to heat. I haven't really been using it that much though. Yeah, a little bit here and there. I might just use it here and there. I don't know. I read something about how it might not be. I don't know if it's good for you or not. I think it is good for you. It probably is. I read one post for somebody saying it might actually make it worse. So I don't know, but I use it here and there. And also, another thing nobody told me about was like sneezing and laughing as well. Like yesterday I had a tiny kind of like blocked nose, or I felt like the inflammation felt like I had a bit of a sore throat. And I wanted to sneeze all day yesterday, and I kept blocking my nose, and it's like, you can't sneeze. If I sneeze, I feel like that blood clot's just going immediately. So I really want to try not to sneeze. And then also laughing. I was watching funny videos and I just kept wanting to laugh, and I realised that when you laugh, sometimes there's quite a lot of vigorous movement in your mouth. So I've been trying not to laugh too much either. Might be overkill. Maybe I don't need to do any of this, but I'm just like, I don't want to have I don't want to have dry socket. I don't want to have infection. I just don't want to mess anything up. Because even if I get dry socket, then that increases the chance of infection, I think. So, yeah, don't want to do anything. I don't fully know what if if he's done something different with my tooth compared with other teeth. Like, so I've had a coronectomy, so that's different. He also packed a load of something into it. I can't remember what it's called. Like, I want to say something like PRF or platelet rich fiber in, isn't it? But I don't know if that's what he did. But he put something like that into my tooth, into the hole, and then sewed it back up again with stitches, dissolvable stitches. The stitches are still there. I presume eventually the stitches will dissolve and then I'll actually have a hole there. I think I've read that that's what's going to happen. At the moment I haven't, though. And when I mentioned about needing to eat mashed potato to swallow my tablets, he said that's fine, we've stitched it, that's fine, you can do that. Like, so I don't actually know what I'm allowed and what I'm not allowed and stuff. Like, I don't know. It might be that my case is different to most people's, but anyway, I'm just going super cautious. Whatever happens, yeah. And so far, so good. And then it's just this numbness is like the biggest concern I have at the moment. So this was the big fear going in as well. And now that I'm here and I've got it, it's not that bad. So, it's not permanent numbness. It is burning sensation. Well, no, is it burning? When I'm not focusing on anything, I forget that it's there. Like if I'm watching TV or something like that, I forget that I've got this feeling here. It's only when I kind of like touch it and I focus on it that I remember it. I'm also slightly unsure how much of it is still to do with the whole info. I'm only 72 hours out. It could be that the inflammation is pressing against the nerve, and maybe that's, so, yeah. So I'm not going to worry for like at least a week or so. And I do think it is starting to come back a little bit on my chin, but maybe that could be wishful thinking. The way it feels is it just feels tight. It feels sore and tight, and it feels like normally it feels like I need to put my lips are burned, like I need to put Lipsil on or something. I keep thinking my lips are dry, and it does hurt a bit to touch that, just a little bit. It just feels a bit tingly, but it's not that bad. I don't know whether it's just an illusion. I suspect it is an illusion, that there's nothing actually wrong. It's just like nerves are misfiring. So with time I would probably get used to it. Yeah. So that's the only concern. At the moment though, I just feel sure it will come back eventually, and it just is no point worrying about it. Give it a little while. But that's the only like downside I think of. If I didn't have that pain, this kind of like soreness here, I think I'd barely feel like I've even been to the dentist. Like, I only feel like slight pains, every little kind of slight dental pain, like a little minor throbbing. But then I have painkillers and it goes, so it's like, it's fine. Yeah. So that's the only problem. But I think that's the overview of my situation. I won't babble on too much longer. The plan is now to 72 hours out now, so I've got some chores to do. So I'm going to start, wash the dishes, wash some clothes and stuff. Start kind of like moving a little bit, talking a little bit. Not too much. I want to get past this dry socket period of like days 3, 4, 5. I want to definitely get past that, so I don't want to go crazy yet. And then, yeah, just going to keep going, see how we get on. And I just presume eventually I'll be able to get off the painkillers. I'll, get off the antibiotics eventually. and things should get back to normal. So another thing is difficult to clean your teeth as well. It says it's really important to clean your teeth, but it's very hard to clean that site there without, you know, I have to go super careful there. So I don't think that second molar is getting cleaned. That side of that second molar is not going to get cleaned for like a week. I don't know how I'm going to clean that. Just can't get anything down there. So, but yeah, saltwater washes and doing my best to get as close to it as I can, I guess. Yeah, I think that'll do. I might make another video in a week or so, hopefully. See if we're getting on better. See if the numbness is gone. If anybody has any questions, if they do happen to watch this, let me know. And I think I'll leave it there. So, okie dokie. See you later. Bye bye.